So, what will you have to pay for Serum Institute of India's Covishield vaccine after May 1? SSI says that it will charge state government rupees 400 per dose and private hospitals rupees 600 per dose for the vaccine. The Pune firm has decided that for the moment it wants to sell the vaccine only to states and private hospitals. The Serum Institute of India has announced the price at which it plans to sell Covishield to states and private hospitals. It also says that the vaccines will be available in retail and free trade in a few months. What are these prices and why you should care? Why is SSI announcing new prices for Covishield? The announcement is a result of the Narendra Modi government's decision to open up vaccinations against COVID-19 to those above the age of 18 years. As per the decision, 50% of the vaccines that companies supply to India will be sold to the open market. States, private hospitals and individual companies that wish to vaccinate their employees. So what are the prices for Covishield? SSI says it will charge state governments rupees 400 per dose and private hospitals rupees 600 per dose for the vaccine. Considering that each person needs 2 doses of the vaccine, this means that the state will have to pay rupees 800 to procure the vaccine for one person and private hospitals would be paying 1200 rupees. The remaining 50% of the doses manufactured by companies are to be provided to the center at a reduced rate. SSI CEO Adar Poonawalla earlier revealed that this negotiated rate for Covishield was around rupees 150 a dose for the center. The Pune firm has decided that for the moment it wants to sell the vaccine only to states and private hospitals. So, who will have to pay for vaccinations against COVID-19 starting May 1? Those between the ages of 18 years and 44 years are expected to pay for the vaccines, as they are not considered part of the country's priority groups of vulnerable citizens under the government's ongoing vaccination program. Since the center will provide free vaccinations only to persons above 45, state governments must provide free vaccinations to all younger adults from low-income families. Migrant workers and their families should receive free vaccinations in whichever state they are located without domicile requirements. Will the prices of the SSI is charging states and hospitals be the same price I will have to pay for the vaccines? No. It is up to states to decide how it will supply the vaccine doses it procures directly from manufacturers, including how these doses will be rationed out and what segments of the population it may or may not charge for them. As private hospitals are procuring the doses at Rs. 600, it is expected that they will add the cost of administering the vaccine and also mark up the prices to include a certain amount of profit, while the center has capped the rate that private facilities can charge those in the priority groups. It has not given any such mandate for the doses that will be sold to private facilities in the open market. It is also not clear at this moment whether states will intervene and cap the prices that hospitals can charge for the doses they procure through the route. SSI has also said that its vaccine will be available in retail and free trade in 4 to 5 months. It is unclear at what price the dose will be available at through this route. However, CII CEO has said at several occasions that he intended to provide the vaccine at around rupees 1000 per dose in the private market. What if I am above the age of 45 years? Will I have to pay these prices? Those aged 45 years and above are considered eligible for vaccinations under the center's public health immunization program. They are therefore eligible for free vaccinations at government centers. If they chose to get vaccinated at private hospitals, they can pay a reduced rate of Rs. 250 per dose under the government's immunization program. What other vaccine will I be able to use starting May 1? Bharat's biotech Covaxin is the only other COVID-19 vaccine currently available in country's immunization program. The Hyderabad headquartered company has so far not made any public its open market prices for states, private hospitals and individuals companies that wish to procure doses to vaccinate their employees. While this is currently a two-dose vaccine, the company is currently testing the possibility of providing a third dose around 6 months after the second dose. Are any other vaccines going to be available in India? Russia's Sputnik 5 is expected to start becoming available to India from the end of May. The price of one dose in international market has been cited as less than around rupees 750 a dose. However, it is unclear at what price Dr. Reddy's laboratory, which will be importing and distributing the jabs here, will provide the doses to the center and in open market. Negotiations between Hyderabad company and the government are still underway. The government is also trying to attract Pfizer, Moderna and Johnson & Johnson through recent changes to its policy on approving foreign vaccines. Which states are providing free vaccination to those above 18 years? Which states have expressed concerns and why? Some states like Uttar Pradesh and Assam have announced that they would provide the vaccines free of cost to those above the age of 18 years. Other states like West Bengal, Kerala, Rajasthan have written to the center arguing that decentralizing the procurement of vaccine for this age group and making them compete with private hospitals would lead to high costs. West Bengal Chief Minister Mamata Banerjee especially has argued that the center refused to allow the state to purchase vaccine back in February so that it could provide free vaccinations to its people. Thank you.